It's the Beth Cahill Show. And now, here's Beth.
Good morning and welcome to the Beth Cahill Show. We are now a couple weeks in on this whole home quarantine. How is everyone doing? And the question that I continue to get, is there an end in sight to this? And when can our lives go back to normal? So although I wish I had that answer for you, I will share, some good and some bad news that we have as far as what they had hoped to see as far as trying to slow the spread. It's still too early to get results on a massive scale as to whether or not this home quarantining is working. Some numbers nationally, though, as of Thursday, the United States has now surpassed every other country in coronavirus cases. I do caution that number, just a tad, because that's if we are to believe what is being reported out of China. So again, I take that number with a grain of salt. It is what you're going to hear being reported everywhere. China has been, less than transparent in this entire process. So I don't necessarily know that those numbers are to be trusted, but you will hear everywhere that the United States is now the leading country in coronavirus cases. So we will take that and we will go with it for now. As far as some numbers right here in our state, Washington has upwards of 3,200 cases and 147 deaths. So over half of the cases are still coming out of King County. They're starting to see more cases in Clark and Pierce and Yakima. They're seeing their fair share of cases too, but the majority of the cases are again right here in King County. There are some King County health officials that are, warning us that that number could double every 5 to 7 days. So for those of you that are out there tracking this, don't be alarmed if that number goes up, because they're expecting it to go up. They're expecting that, again, it could double every 5 to 7 days. They're finally getting a handle on testing, and it's becoming more and more available. So with more testing comes more positive results to COVID-19. So Jay Inslee did say that the 2-week quarantine may not be enough time. So for all of those people wondering, are they getting back to their regular lives anytime soon? I don't think so. We're going to have to watch what comes out of the governor's office, but he did say that he is going to probably have to extend that quarantine. On a national level, New York continues to be the hardest hit area in our country. There are only 5 countries worldwide that have more confirmed cases than New York. Number 1 being the United States, 2 being China, 3 is Italy, 4 is Spain, 5 is Germany. So those are the top 5 countries with the highest number of COVID-19 cases. And New York State falls at number 6. New York is being hit hard. I mean, it's really, really sad to watch. Listen to Dr. Birx address this issue here.
Finally, and I know Dr. Fauci will talk about this further, we remain deeply concerned about New York City and the New York metro area. About 56% of all the cases in the United States are coming out of that metro area, and 60% of all the new cases are coming out of the metro New York area, and 31% of the people succumbing to this disease. It means, because they still are at the 31% mortality compared to the other regions of the country, that we can have a huge impact if we unite together. This means, as in all places, they have to be following the presidential guidelines that were put out 8 or 9 days ago, and this will be critical. But to everyone who has left New York over the last few days, because of the rate of the number of cases, you may have been exposed before you left New York. And I think, like Governor DeSantis has put out today, everybody who was in New York should be self-quarantining.
So it got out of hand in New York before they were ever really able to contain it. Mayor de Blasio and Governor Cuomo have seemed to be on opposite pages regarding this. It's not probably helped the situation for New Yorkers there. It'd probably be easier for everyone if they could get on the same page. I do believe that Governor Cuomo has had great leadership under enormous pressure in his state of New York. Coming from someone who visits New York often, as I do, it is by far my favorite city in the world. I am pulling for all of New Yorkers, and I will keep you guys up to date on what is happening there as well. But again, Governor Cuomo, if you can tune into some of his pressers they are really good. I share, very little in common on political issues with the governor, but when he speaks, I believe what he's saying. I trust what he's saying. And I think, again, he's doing an incredible job with a really, really bad situation coming out of New York. I also think it's worth mentioning that while the United States sits at number 1 for COVID-19 cases, that we are number 9 on the list for death toll. No death is okay. I'm not suggesting that it is. But what I am saying is that is a snapshot into our great healthcare system. I quite honestly, I'm tired of hearing people bash the United States healthcare system. Between the healthcare system and the private sector coming together to try and fill some of these gaps that are missing, the United States doctors and nurses are managing to keep the death toll down, and the number of recovering patients continues to rise. There's something to be said for that. It still is true. It still holds true today that 80% of the people that will contract this virus are going to be just fine. They're not going to need to go to the hospital. They can recover just fine at home. They can be asymptomatic. They can feel like they have a flu. They can feel like they just have a cough. 80% of people are going to be just fine. That still remains true to this day. No matter what you're reading anywhere else, that holds true. So for anybody that, is needing a little bit of hope out there, that's the hope that you're looking for. So we need to make sure that that 20% is taken care of and that we have the resources to do just that. But those numbers, that's a good number. It's a good number to hold on to. So I do want to move on to the much needed relief for the American worker. The House and the Senate passed the $2 trillion stimulus package this week. So I want to take you through a few parts of that and how it can possibly affect you personally. First, I did want to listen to the president discuss this week.
The massive $2.2 trillion relief package includes job retention loans for small businesses with loan forgiveness available for businesses that keep their workers on the payroll. It's pretty good. Loan forgiveness, keep the workers on the payroll. It's pretty good. Direct cash payments will be available to American citizens earning less than $99,000 per year, $3,400 for the typical family of 4. Expanded unemployment benefits. The average worker who has lost his or her job will receive 100% of their salary for up to 4 full months. These are things that, by the way, we have plenty more to go, but they're things that nobody's ever had any package like this done, and I just want to thank them.
So the president was in rare form, actually, because what he did not say was the absolute mess that led up to the Senate passing this deal. One that I believe is going to cost the Democrats on Election Day. Maybe not everywhere, but there are a lot of areas and a lot of people that were really turned off by the way that they behaved leading up to the passage of that bill. The Democrats held up this bill from passing and getting money into the hands of the Americans that needed it most, and the small businesses that needed it most. 1 week is a big deal when you've got bills to pay and trying to keep your employees working. It's a big deal. And it was a shameful, shameful move by the Speaker of the House, Nancy Pelosi. So Democrats and Republicans, they worked for days on this bill, and there was, input from both parties. And right before there was an agreement to be made, Nancy Pelosi flies into town from California with this list of demands that had absolutely nothing to do with the coronavirus. She added crucial days to this debate. Meanwhile, Americans are sitting out there wondering how they're going to pay their bills and put food on the table. It was a move that people truly have come to expect out of Washington, D.C., as sadly as that is. But you would think that during a pandemic like we're facing, one that is truly, truly something like we've never seen before. I mean, the government shut down the American economy. That was of no fault of anyone else's. It was of no fault of the American worker that they weren't receiving paychecks and the businesses were shutting down. So to hold that bill up based on things you're trying to throw into a bill at the last minute that have nothing to do with the coronavirus, it's disgusting. Listen to Kevin McCarthy speak on this.
We are working for every American in this country, and we want them to know that help is on the way. Sadly, though, there are some individuals in Congress who, even in the midst of a pandemic, think this is a tremendous opportunity to restructure things to fit their own vision. They're more focused on dividing us rather than trying to bring this country together. Those people want to debate election law, Green New Deal, or sanctuary cities. In a bill that is meant to assist those who are struggling families, our health, and our security. Every day matters as we debated a solution that would deliver much-needed relief. We just watched in the last week 3.28 million people laid off. That's higher, multiplying higher than we ever watched in the financial crisis. The Speaker herself just said every day, every week that is wasted on not taking this seriously is a problem. I could not agree more. And yet for days, Democrats stalled this bill. How many people were laid off as the Democrats fought to change the election law or implement the Green New Deal? How many parents lost sleep wondering how they were going to make the payments on the next month? How many small businesses sat around a kitchen table and had to make that decision they never had to before about laying their employees off that are like family? A few minutes ago, the Speaker stood at this podium and claimed that House Democrats did what she called a jiu-jitsu to change the bill. That is an outright lie. The fundamental portions of this bill has not changed since Sunday. 4 months for unemployment was already decided on Sunday. The grant to keep employees hired on small business was already decided on Sunday. The only few additions were funding of things that had nothing to do with the coronavirus. Was that worth holding it up and more people being laid off? More people losing sleep? More people wondering if they can continue? Those are the type of games that have to stop in Washington.
You know, I have tried to be less political during this just because I think that it's not helpful to the cause. It's not helpful to what we're trying to do here as Americans. At the end of the day, we're all Americans. But there are parts of this that you can't ignore. And to give Democrats a pass on how they behaved this week when Americans needed them most, it's something that I just could not do. So let's get to it. What is the biggest economic stimulus package in American history? First item is that most Americans are going to get a check for $1,200. So if you make up to $75,000 or below, or a couple making $150,000 or less, you're going to get $1,200 if you're an individual, or $2,400 combined. If you are also eligible, if you have children, for a $500 per child payment as well. The payments are going to start to phase out for higher income earners. They're not going to go to single filers making over $99,000 per year, or for head of household filers making more than $150,000 roughly per year. So that's a good thing, right? People need money. I am not for big government spending. I never have been. But this one I can get on board with because, again, it's of no fault of the American worker that they are out of work right now. No fault of theirs, and they need this money. And oddly enough, I'm actually saying that I don't even know that it's going to be enough money, but it's a start, and it's something that can give them a little bit of relief. And hopefully they will be expecting that in the next week or two. The hospital industry is another industry that's getting helped out. They're getting exactly what they asked for, which is $100 billion in rescue funds. So that is great. That is, exactly what they needed in this moment. Airline industries are also going to receive $58 billion. So this one is figured in $29 billion in grants, $29 billion in loans. So that's a good thing too. The airline industries, we love them and we hate them, but they are getting some relief there as well. This bill also beefs up unemployment benefits. So people who are unemployed are going to get $600 per week for up to 4 months. And that is also on top of state unemployment benefits that are going to make up for 100% of lost wages. This is a big deal. $600 per week for up to 4 months is something that we haven't really seen in most places. So that is a great thing for unemployment benefits. There is also $500 billion going to money that is basically money that is there to loan to industries. So essentially, the Treasury Department's going to take this $500 billion. They can divvy it up to industries that are struggling, industries, that have been hit really hard. So you think of, airlines, hotels, restaurants, and that money can also, part of that 500 billion can also go to some cities and states that are being hit harder than others. So moving on to businesses. Businesses are also going to get a tax credit for keeping American workers on their payroll. This is a big deal because this is going to help keep unemployment numbers down, if that's even a possibility, because unemployment numbers are skyrocketing. But this is going to give incentive to businesses to keep workers on their payroll during the pandemic. So as long as you keep workers on your payroll during this pandemic, you can get a refund for half of what you spent on wages, up to $5,000 per worker. So that's a big deal. And it's something that, hopefully businesses will keep, their workers working during this time, and they'll get some relief for doing just that. State and local governments are going to receive $150 billion. And then employers and self-employed individuals, they are going to get to defer the tax that they pay on wages, and wages that is used to fund Social Security. So if you're an employer or if you're self-employed, you can defer that tax that you pay on wages. So that's a good thing as well. And then as far as food stamps and child nutrition, they are going to receive $25 billion. And there is going to be emergency assistance for schools, and they'll receive about $30 billion. So this is going to go to funding for colleges, for universities, and for states and school districts alike. And finally, some much needed relief is going to come for the farmers and the ranchers who have been working so hard. They are going to receive $24 billion. So this bill, there's a lot of things in it that I didn't love. There's a lot of things in it that I really, really thought were good things for American workers. It's an 800-page bill, so there's a lot more to it. But I did want to share the big items in it, and hopefully they can start to see some of these checks coming out, and we can talk about that next week. I did want to, close with kind of what's going on in the media right now, right? There's been much talk over the last few days about the daily task force briefings and whether or not media outlets should air them. In a time like this, it's crazy that I would even have to say this, but yes, media outlets are actually trying to see if there's a way that they can stop airing these Corona Task Force briefings every single day, which that's their right. They get, they can air whatever they want. Do I think it's a good idea? No, I don't. And the reason that this is important and that I want to talk about it is because for anybody that's been paying any attention at all, the press has been badgering the Trump administration to start giving press briefings daily. There are reports out all the time that these briefings haven't happened, and they really want to come back to giving daily briefings. So fast forward to where we're at right now, when the president, the vice president, are at your disposal every single day to answer your questions, whether they're related to this pandemic or not. Plus, on top of that, you have leading health experts also available for the American people to hear straight from them. And now there's talk of getting rid of these briefings. I mean, the president puts together a task force to fight the virus, keep the public informed, and they've done an excellent job of doing just that. I mean, these briefings are a must watch for anyone wanting information straight from leading doctors and scientists, such as Dr. Fauci and Dr. Birx. They give it to you every single day, especially when you get to hear from Dr. Fauci and Dr. Deborah Birx. They are so knowledgeable on the topics that are important. I mean, they're so knowledgeable, and they speak in a way that is incredibly easy to understand. So since these briefings have taken place, the president's approval numbers have also increased. And now the media is going to say they're not sure whether they should air the briefings anymore. Do you think that that is a coincidence? The president's numbers are rising. because the public can actually watch him every day, unfiltered, unedited. I mean, the press can't edit what he's saying, right? They can't just take these little tidbits and pass it on and have no context. They can't do that anymore because he's there every single day, sometimes for 2 hours at these briefings. And the president has been at his very best during this pandemic. And poll numbers support this, not only for his overall approval rating, but also with his handling of the coronavirus. 60% of Americans approve of the job that he's doing. We have a problem in the American press, and I take absolutely no joy in saying that. I went to college for journalism. I believe in the press. I just wish that we had an honest media, especially in times like this. And it seems most Americans agree with me. There was a Gallup poll released this week where Americans were asked if they approve or if they disapprove of 9 key groups in their handling of the coronavirus. 9 key groups. And Americans, by and large, approved of all but one group. That group was the media. The media was underwater by double digits. And there's really no better way to describe this than the effort that has been in place over the last 48 hours online, or, just watching cable news outlets, to smear Dr. Deborah Birx because she did not approve of the doom and gloom scenario that the media continues to put out there. Dr. Birx came to the briefing with a message to Americans. She rebuked much of what the media has been reporting about, not just the number of deaths related to COVID-19, but also the state of medical supplies in our country. Listen to her here.
There are still ICU beds remaining, and there's still significant over 1,000 or 2,000 ventilators that have not been utilized yet. Please, for the reassurance of people around the world, to wake up this morning and look at people talking about creating DNR situations, do not resuscitate situations for patients. There is no situation in the United States right now that warrants that kind of discussion. You can be thinking about it in a hospital. Certainly many hospitals talk about this on a daily basis. But to say that to the American people, to make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now. And it's our job collectively to assure the American people that it's our collective job to make sure that doesn't happen. Right now, you can see these cases are concentrated in highly urban areas. There are other parts of the states that have lots of ventilators, and other parts of New York State that don't have any infections right now. So we can be creative, we can meet the need by being responsive. But there's no model right now, no reality on the ground where we can see that 60 to 70% of Americans are going to get infected in the next 8 to 12 weeks. I just want to be clear about that. So we're adapting to the reality on the ground. We're looking at the models of how they can inform.
I just think that when a leading doctor and infectious disease expert has to come out and rebuke our media because what they're reporting is just plain not true, we have a problem. And that is why you see the media's approval ratings underwater. Congress even had a higher approval rating than the media. Congress has had one of the lowest approval ratings of all categories for as long as I can remember. And even Congress ranks higher than the American Press Corps. I hope that they will start to report accurately for the sake of this country, and I hope that they will continue to air these daily task force briefings for all of the Americans that want to get straight answers from doctors, from health officials, and from the President of the United States. So that is it for me today. Please tune back in next week at 9 o'clock. Stay safe out there, you guys. Keep washing your hands, and we will be back here same time next week.
This has been The Beth Cahill Show. If you have any feedback for Beth or would like to suggest a future topic or guest for the show, email beth@thebethcahillshow.com. That's Beth at the Beth Cahill, spelled Cahill, show.com. Tune in again next Saturday morning at 9 for more of The Beth Cahill Show, right here on AM 1590. The Answer.